Good afternoon, and I really, at the very onset, I thank the organizers for giving me this opportunity to talk on avenues for young researchers in India. This is actually my favorite topic, and I have been doing this activity in the Northeast region for almost a decade now. And I'm really happy that this has been selected as one of the topics for this conference as well. As you know, biomedical research is biomedical. In fact, I will add here, health research is critical for advancing health of the race. Analysis of a study, a research output from 517 Indian medical institutions and hospitals between 2005 and 2014 has reported that only 25% of the Indian medical institutions have produced more than 100 papers in a year in comparison to the Western countries where the number is much higher, and this was published in clinical medical research practice in 2016. So you can see where we stand in terms of research. And approximately we have 7,000 R&D institutions in India, and the expenditure also have increased over the years. But the publication report, as it is seen, although the numbers have increased, but still we have miles to go. Of course, in the recent analysis in 2018, it has shown that Indian scientists have published more than around 170,000 research articles in journals as indexed by Scopus. So this simply tells us in volume how much more we need to do, because considering the size of population of our country, and that I think it's the second largest country in the world, and then also see the number of people, and then the diversity of our population. There is so much more to do. As we have been talking in terms of MDG, and now we have, although we have been able to achieve some of our goals in terms of health indicators, but then newer things are coming up. We are in the stage of epidemiological transition. However, I think with the emergence of coronavirus, SARS here and there, we cannot even say now, infectious diseases are under control. There will be emerging and re-emerging diseases, and due to several factors, non-communicable diseases are also on the rise, whether it is due to environmental pollution or something happening in terms of our, in the makeup. We really don't know what are the reasons. We really need to find out what are the causes and for contributing to all these conditions that our nation is facing today. Research is an integral part of the medical education, but how many of our medical colleges are actually involved in research? And BMJ 216 has reported that nearly 6 in 10 medical colleges in India did not publish any research in the past 10 years. And one of the articles published in IJMR 2009, it says that funding agencies have, major programs for medical sciences, but the takers are many. So, guys, wake up. All our young faculty, students, I think there are opportunities for everybody at every level for doing research. So, what are the main, if we have to do research, right? We will need fund. Research simply doesn't mean collection of data. The literal meaning of research is, systematically investigating a condition, right? So we have to do it in a systematic manner. For doing that, we need money, and also we need resources, and in terms of manpower, and also in terms of infrastructure. Manpower, that has to be skilled, right? So what are the main funding agencies that we have who can support our research, and what type of research do they fund? So that you all know the spectrum of research, which ranges from basic translational, clinical, and health system research, and we have different funding agencies, and their funding support they provide, like DBT, DST, which are basically basic and to some extent clinical, and we have here DHR and ICMR, which supports research in all spectrum of health research, right? From basic to health system research, implementation research. Then we have international funding agencies also, which are big names: WHO, NIH, all of you know, Wellcome Trust, Gates Foundation. They not only fund for research, they also, all of this funding agency also has program for developing skills of the researchers. And there are other funding agencies also, like for example, UGC, which basically funds for promoting research in the universities and in the institutions, AICTE, CSIR, and there are some government and non-government, which are societies, but basically they, they provide fellowships and travel grants. As I said, ICMR is as you can see from the previous slide, ICMR is the main apex body to support, research in the country. And I'll be talking mostly about ICMR. What are the opportunities for the researchers from ICMR and DSR perspective? So as you know, ICMR is an apex organization to formulate, conduct, coordinate, fund, and promote biomedical research in the country. This is the oldest organization, more than 100 years old, more than MRC. All of you know about MRC. It's under Ministry of Health and Family Welfare. It was funded in 1911. And now it is, DHR was established in 2007 as a separate department under Ministry of Health and Family Welfare. So the main mandate of Department of Health Research is to promote, coordinate basic applied and clinical research, promote research governance, intersectoral coordination, promote public-private partnership, and training, which advanced training, I will go into details. What are those? International cooperation, outbreak investigation, so on and so forth. And one of the functions is Indian Council of Medical Research. So what are the schemes under the Department of Health Research? As you can see, human resource development in health research, one of the main agenda under Department of Health Research, where grant of fellowships in India and in the foreign institutes for faculties of medical colleges, women scientists, etc. are provided. And then also there is grant in aid schemes for intersectoral convergence and coordination for health research, health technology assessment. And then DHR has established nationwide network of laboratories for managing epidemics and natural calamities. And it has also established multidisciplinary research units in government medical colleges, to promote research in the medical colleges. And it has also established model rural health centers, which are located in close proximity, either in the PSC or in the CSCs, to bring health to the mass population, to the rural population. As you can see, mostly research is being done at the tertiary medical college level. But here that, in terms of infrastructure strengthening, there is equipments and provided, manpowers are provided, and medical colleges around that. Even the secondary level hospitals who are around there can do research which are locally relevant, which are needed for that area. So it's basically, we are moving towards attaining sustainable goals, improving access, universal coverage through research. So under the human research development for health research, the major objectives are to increase overall availability of the trained personnel for medical in medical colleges across the country through scholarships, fellowships, career advancement schemes for the faculties and young medical doctors and other scientists to take up medical and health research as a career. And also to focus on the creation of cadre of trained medical and health researchers in specifically identified priority areas of health research, and to create and support, nurture and encourage those trainees, and to establish sustainable suitable online teaching and learning facilities for the researchers in the medical colleges and in the various institutions for health research. I had actually links, so they may not be really visible to to all of you. So these are different, HRD schemes. What are they? Long-term and short-term fellowships for training in Indian institutes. The long-term training, which is for the duration of 6 to 12 months, and short-term ones are for 1 to 3 months. There are eligibility criteria experience and age criteria and all that. When actually anybody from the medical colleges who fulfills these criteria can apply for that. And then there are also long-term and short-term fellowships for training in foreign institutes also. And startup grant, those who are trained and who earn some skills, get some skills to, they are also given as startup grants for those fellows who have undergone training for carrying out that research in their institutions, and they are supported for 3 years. And the grant, if you look at the guidelines, it's quite good. Anybody who is interested should try for that. And then there are fellowship programs for young scientists. There are categories of A and B for medical and non-medical people. And again, these grants are given for 3 years, and there are eligibility criteria, age and in terms of experience. And then even those who are not so experienced but write good proposal can also apply for grants. And fellowship programs for the women scientists. Many a times what happens, women in their career have to take breaks sometimes, and they are not in a position to carry out their research. But if they can get attached to an institute, if they are in the institute, there are provisions specifically for the young women scientists as well. And then even for the institutes, there is support for the institute for imparting training, and this is one-time grant which is up to 50 lakhs for filling up the gaps and upgrading their facilities in the institute for carrying out the research. And then there is also grants available for strengthening of research through establishment of online courses, and there is mentorship programs and all that. And then there is also research grant and fellowship to encourage health research personnel who are in the, who are non-Indian, but they want to come back to India and then pursue research. Even there is provision for such individual to come back to India and carry out research. And you can see here for them grant for up to 5 years to set up research career in India, right? Being provided by Department of Health Research. So as you can see, there are so many opportunities under Department of Health Research for the young researcher. Young researcher, many a times we said we have no fund, we have no provision, but there are a lot of opportunities. I must say the one who are there now are really fortunate to have such exposure to so many facilities. I don't think Dr. Chilani will agree with me. Earlier times there was nothing such. There were, I think, only few could make it. Then there is GIA scheme under DHR for intersectoral convergence and coordination. The basic objective is to support and encourage focus and deliverable research for estimation of disease burden or development of new technologies, and to support studies pertaining to technology and translation of those leads into products and processes for translation for using in the public health system, and also developing collaborative health research involving different S&T organizations, and also to evaluate the existing processes, products or technologies in, for their comparative cost effectiveness to save the public expenditure. So in terms of infrastructure development, DHR has, as I said, created a huge opportunity in the medical colleges, multidisciplinary research units. They have been established in different medical colleges to strengthen research environment in the medical colleges and to encourage faculty of all disciplines to undertake health research. So right now, I think we have more than 80 MRUs established across medical colleges, and then model rural health research units to create infrastructure at primary health center for transfer of technology to improve quality of health services and conduct research in relevant for rural population. Then we have viral diagnostic and research laboratories. I'm sure in today's time, COVID-19, all of you are aware, where the preliminary testings are being done across the country in all these viral research diagnostic labs. Coming to ICMR, so ICMR also has been supporting research in the form of intramural and extramural research. The intramural research is promoted through its, carried out by its 26 disease-specific specific institutes located in different parts of the countries, and 6 regional medical research centers. And then grant in aid projects, which we call extramural, they are being supported in terms of ad hoc projects, which we call grant in aid, task force studies, and by establishing Center for Advanced Research, where in universities, medical colleges, research institutions, hospitals, and recognized research and developmental labs, and even we fund the non-governmental organizations which are recognized for carrying out research. These research grants are actually intended to supplement the research facilities at the host institutes, not to establish a laboratory or the whole facility for doing research. That DHR has provided, which you could see, the MRU, MRHRUs. So these are the ICMR institutes located in different parts of the country, and these are the field stations, and you know that many of ICMR centers are also recognized have international recognition for doing research in various areas, like the one in Calcutta, NICED, for research in diarrheal diseases, RMRC Port Blair for leptospirosis, tuberculosis research center at Chennai, and National Institute for Research in Reproductive Health in Mumbai, NIV, Pune, and so on and so forth. So what are the thrust areas of supporting research for ICMR? As I said, it covers all spectrum of health sciences and all disciplines like communicable, non-communicable, maternal child health, nutrition. It also supports research in ethics, IPR, socio-behavioral sciences, and so on and so forth. Then under the extramural grant, we have the major program, and many of these are now combined with Department of Health Research, support for human research and academic research program, which we call SERP. And these are the various schemes like fellowships, support for MD, MS, and PhD. Actually, this is ongoing at 3 centers. The MOU has been signed in KGMU, Lucknow, NIMHANS, Bangalore, and SRI Ramachandra University in Chennai. So in these 3 institutes, one can enroll for these programs, MD, MS, and PhD. Then financial support is also provided for MD, MS, and thesis, and postdoctoral fellowship. This is after post-graduation to carry out further research in that area. And then ICMR also provides funds for organizing clinical training, research, etc., and for international travel, which is again combined with DHR. Under the fellowship, GRF, SRF, Research Associateship, and STS. These are all intended for actually improving the skills among the medical college students and postgraduates, and also all are meant for faculties also. The GRFs are basically for the these are through examinations, 3 years GRF. After that, they get the examinations are conducted at 6 centers across India, and there are 156, 120 for medical and 30 for the dental. And SRF, after 3 years, GRF can become SRF. Their programs are being evaluated by committee. And SRF, one can apply under faculty of any institution of a medical college under one guide in some different projects. And short-term studentship. So among the students, to promote research culture, this has been going on since 1979, and there has been very good response. And now the number of STS has been increased to 1,500, 1,200 for MBBS students, and 300 for BDS. So it's not only medical pure, but we are also dental, students. They are also being promoted, because I believe dental health is also, if you have to think of overall health, it's an important part. So this, to inculcate, to promote the culture of research has been the focus of ICMR, and DHR has been on to catch the students right from the beginning and supporting them till they finish their MBBS and their post-graduation, and if they want to take up research, and even to sustain research after that. And these are for the young ones, and even for the senior ones. There are schemes for adjunct faculty scheme, ICMR Emeritus Scientist, and ICMR Chair. Those who have retired can also, to pursue their research of interest and of relevance, they can apply for these positions for support. Among the extramural grants, which many of you as faculty must have been applying to ICMR, these are ad hoc research scheme, which are investigator-oriented on any discipline of health and biomedical sciences that is of interest to the researcher. And then National Task Force Studies, which are centrally commissioned program. They are time-bound with specific objective and generally multi-center on a nationally relevant sub-priority, multicentric, and they are implemented through, following uniform methodologies. Then Center for Advanced Research is for actually doing in-depth research on a specifically identified problems with aims of reaching a scientific conclusion on a disease on a disease on its causation, progression, and management or prevention. So this Center for Advanced Research are generally located in the medical colleges, or it could be in the non-ICMR institute also. Then there is also provision of grant under international collaboration, joint collaborative projects. ICMR has signed MOU with different countries. So there are call for proposals at different times on area of mutually identified priority areas. The Indian counterpart is then supported by ICMR. So you can see there is whole lot of opportunity that is in front of you, brought out by ICMR and DHR. So who can submit this proposal? Those who fulfill the criteria for anything will have to have criteria. There are ACE criteria, there are qualification criteria, right? And the personnel working in a permanent position in institutes and medical colleges can apply. So when and how to submit, that is one thing one must know. So earlier, ICMR used to receive applications throughout the year. We are in the process of streamlining. We are moving into e-governance system. We have started online submission since 2012. We had in between receiving application in 2 stages, concept and then full proposal. This year onwards, we have moved to a full proposal submission. So the submission is open now once a year under ICMR and again once a year under DHR. So one must keep looking at the website for the opportunity to submit your application. It doesn't mean that we submit something and then we, accept our proposals should be granted, right? There will be criteria for evaluation also. So important thing is to see, and the reviewers, everything that is submitted to ICMR undergoes review. What are the things, critical things that are being reviewed? Does it address an important scientific question? It's important. Not that Me Too science should be done, right? So and so has done, I should also do. Not that. It has to be relevant. It has to, something new should be there. Then the scientific quality. So is there a base for doing that? Is the methodology appropriate and can it be realistically completed with the timeline? All these things are important. And also the funding agency definitely will see whether there is appropriate facilities available. For all of you, for information, I have given a whole list of institutions and the ICMR institution and the medical colleges which can be seen on the website. If you do not have any facility at your institute at the moment, you can always collaborate with ICMR institutions and other medical colleges where those facilities are there. And also it is, reviewer will say whether appropriate expertise are on board or not. We have seen many times a paramedical person will write some proposal on clinical things, but there will be no clinical investigator. Similarly, for the clinical people, anything doing with the lab investigation, they will. So these are small things, but very important. And when we have to judge in terms of quality, those small things become important many a times. Then logical and well thought out plan of investigation is there or not, and value for money. Any investment done, some value, there has to be some value, which is also very important. So what is important now? We know that there is something for us where we can look for, where we can approach. What is important? We have to check priorities of the funding agencies. I'm talking for ICMR, but there are other funding agencies also. What are their priorities? And also their funding requests, funding cycle. All that we have to see. And what are other requirements? There are formats. We have to follow those formats. And funding volume, it's not that unrealistic. Something is asked for, we ask for something else. What type of grant? And for foreign funded projects, there are different rules again. And many times what happens, there are queries by the reviewers, by the funders, promptly acting to that, right? If we miss out on time, then we lose that opportunity. So there are lot of options, yes, but getting grant is difficult. It is very competitive. We must keep it in mind. So we have to be really geared up for that. But it is possible, right? We have to follow what are the requirements and act timely on that. The writing process has to be really very precise, right? And we need to follow those 3 C's: concise, clear, complete. And pay attention to what are the requirements. We really need to develop endurance. It will happen. And we have to really work hard to build credibility. So these are the different things which you can see that available on ICMR website for information. I have given here the links which probably you cannot see here. Go visit the ICMR website and DHR website as well for details of all this information. And I request all the young researchers to check those websites and see where you fit in and for which grant you can apply in the next cycle. All the best to all of you, and thank you organizers for giving me this opportunity for sharing this experience of ICMR about the funding opportunity, bringing up in front of you, and looking forward everybody's, support, because funders may have money, but then there has to be people who will do the research, right? Thank you so much.